Lymphedema following mastectomy and breast surgery can be a very complicating scenario. Women who have lymphedema following mastectomy have a lot of issues, not only with pain and swelling in their arm, but also a quality of life. And for the most part in the past, conservative measures have helped tremendously with this, but not always completely. And that's why there is a subgroup of patients who are great candidates for what we call lymph node transfer or vascularized lymph node transfer. That involves microvascular surgery of taking lymph nodes from one area, typically around the groin, and transferring this up into the arm to be able to give the lymphatic flow a new channel and to decrease the swelling and the pressure and the size of their arms, as well as the pain and discomfort. In terms of lymphedema, transferring these lymph nodes from one area to the other area is a new technique that's only been around for about the last 5 to 10 years. And the reason that it's so cutting edge is that only a few areas in this country and even world will offer this type of surgery. And the results are good. And we're still in our infancy in terms of realizing who is a good candidate, who's not a good candidate. But for the most part, women that have failed conservative measures that aren't in the extreme, that are not reversible, are great candidates for this surgery, meaning that people who don't have thick, woody arms, but more kind of modest to moderate lymphedema are great candidates for this type of surgery. And postoperative care is important, and that's where physical therapy is of the utmost importance, not only with aggressive compression, but also with all the different modalities that they have to help with the surgical aspect of this, because it does take time and it does take modalities to be able to get this pressure down so that those new, those new lymph nodes can really find a new home and create those channels to decrease the pain and the pressure in that arm. Now, for the most part, we don't know whether or not it's going to be able to reverse it completely. For most of the patients that I've done this on, symptoms are the number one thing that go away. The size of the arm are number two. Not always does the size of the arm go down, but the amount of pain and pressure and symptomatic relief that they get from the surgery can be quite substantial. Sometimes just with autologous breast reconstruction, so using your own tissue, for people that did not have that before, that can cure it. And I've seen that in about 10 to 20% of my patients just by doing autologous breast reconstruction with a deep flap or an S-gap flap, that I'm able to get those healthy new vascularized tissue, which does include some lymph nodes, into that area. And just by doing breast reconstruction, actually I've seen lymphedema resolve completely. I've seen great results in terms of decrease in the amount of pain and pressure and swelling in those arms. People were able to wear rings where they weren't able to wear rings before. People have stopped using their compression garments where they had to use it for the rest of their lives before. So that's one avenue, is if they haven't had breast reconstruction using your own tissue, is to try that first. And if that doesn't work and conservative measures such as compression hasn't worked, then doing the lymph node transfer is a great option. And physical therapists are an important avenue in the team approach for the postoperative care for this and play an integral part of the process.